Health and Prevention. May I request you to proceed with your...
Thank you very much. Good afternoon, everyone. And first of all, I have to say thank you to the organizers of the Congress for this invitation, Dr. Vivek Kute, for invite me to be here today. And then in the following 15 minutes, I will share with all of you the challenge and opportunities that we are facing in UAE, United Arab Emirates, to implement the disease organ donation program. So I used to start this type of explanation or information talking about why is important organ donation, and I think that in this auditorium is very evident why we need to implement this type of practice. And then we will go for the UAE performance. So this is from the Global Observatory in Donation and Transplantation from the World Health Organization, just to highlight that we have about 157,000 solid organ transplant performed every year worldwide, but this is only less percent of the global needs, or this cover less than 10% of the global needs. We know that organ transplantation is the best indication for some chronic diseases. When we talk about kidney, you are the clear example, and you know these numbers better than me, comparing dialysis or survival of the patient in waiting list versus kidney transplantation. We all know that is much better offer the possibility of kidney transplant than remain the patient in waiting list or in dialysis. And if we talk about costs, in US, for example, we know that the treatment of the kidney failure consumes 6.7% of the total Medicare budget, and this is to treat less than 1% of the population in the US. Also, we know 10% of the population worldwide is affected by chronic kidney disease, and there is this statistic about the people in age 65 through 74 worldwide. It's estimated that 1 in 5 men and 1 in 4 women have chronic kidney disease. So there is no doubt that organ donation is for organ transplantation as the best indication of chronic and terminal diseases. And this is from World Health Organization Madrid consultation, where World Health Organization is inviting all countries to become self-sufficiency in both disease organ donation and transplantation. So what is happening in the world regarding donors per million of population? You can see here dark blue are the countries with the highest donation activities. In the previous presentation we saw some figures as well, how Spain, US, and of course other countries in Europe, they have the highest rate with 41, 45, 46 donors per million of population, and other countries, they are trying to develop their own programs. And then when we start to analyze what these countries in dark blue, what they are doing, so many myths about the solution, no? They say it's because of the religion, so some religions are more pro-donation. We know that this is not the case. It's because of the consent legislation, so only the countries that they have opt-out legislation are more pro to organ donation. This is not true. We know that there are countries, US is the second best in the world and is opt-in their legislation. So some myths about solidarity. So some countries has more prone to solidarity than others. So this is Eurobarometer, and a study from Europe that what they did was survey the population about their willingness of organ donation, and then after that they cross with the donors per million of population. This is donor per million of population rate. There is any correlation between the countries who answer with the highest percentage of willingness to donate versus the actual donor consent rate. Here we can see Spain, that is particularly when they survey the population in Spain, about 57–60% of the population in the street. They say, yes, maybe one day when I die, I will donate my organs, but we know that 90%, the consent for organ donation in Spain is 90%, and I have to say consent, because even if opt-out, the families are interviewed, and also the families can refuse organ donation. So what is happening? And then I will mix with UAE performance. So what is happening in UAE is this. Disease organ donation started in 2017. Before that, we didn't have law regarding brain death, equal death, only after 2016. So in 2017, we initiate with 0.3 donors per million of population, and last year we have 9.1 donors per million of population. It was a 65% increase compared 2023 versus 2022. What is happening in the country? We have to go to 2016. So let me show you UAE in 2016. As I mentioned to you, no disease organ donation at that time. UAE is a country ranked at the very highest development category. We have more or less 9.9 donors per inhabitants. 29% of them are located in Dubai, 50% in Abu Dhabi, although Abu Dhabi is this one, is the region with the highest extension, but the less population in the country. We have, as India, we have a public and private system with a Ministry of Health and Prevention and 3 state healthcare authorities, Dubai, Abu Dhabi, and Northern Emirates in Sharjah. And you know that 85% of our population is expat. From different realities, I have to say that about 30% of them are from India. The second biggest population is from Philippines, and of course we have from everywhere in the world. And all UAE residents, mandatory, they have to have a health insurance coverage. You know, the majority of the people who come to UAE, they come to work, so they come, it's mandatory for them to have this. What else? The first kidney transplant living-related organ donation was in 1985. So the country is performing kidney transplantation from living donors from 1985. But as I mentioned to you, only till 2016, we got the approval of the federal decree law where equal the death by neurological criteria as the death of the person. So from that time, we start to implement a series of strategies, but more important, customize to the reality of UAE. So you have here the list. We don't need to invent. There is a clear studies and analysis over the years that explain what is the key for disease organ donation. The challenge is how you take this list and you customize and implement according to the reality of the countries. Spanish model work in Spain, American model work in America, but UAE has a completely different reality. So we know about the in-hospital organ donation unit. We also call critical care services. They are a specialized unit inside of the hospital dedicated to organ donation. So organ donation is a hospital process. All the efforts of the system and the structure must be focused inside of the hospital. So for us, disease organ donation is a hospital service as any other service, cardiology department, radiology service, or neurology service. Disease organ donation is a hospital service. What this means? That every patient in a hospital, admitted in a hospital, with futility of the treatment, with poor prognosis, and death by neurological criteria, is mandatory to offer the possibility of disease organ donation. And this is something that, in that way, you start to change the mind of the healthcare professional inside of the hospital. This is from UK, and I bring this is because this task force conclude that organ donation should be seen as a normal part of end-of-life care. This is what is happening in other parts of the world. Organ donation specialists, we have to have doctors and nurses from ICU and emergency department, dedicated as well, part-time dedicated. This figure is from Spain in 1989, that one of the first strategies for them was implement this donor coordinator profile. We do have our donor specialists, doctors and nurses. You can see here from different hospitals. What is the particularity? They are not full-time, of course. They are working inside of ICU. They are, some of them, if not the majority of them, are head of the ICU, but they are also the head of the organ donation unit. And of course, nurses. Nurses are important, so nurses also are a key part of these organ donation units in the hospital. National system with national or regional transplant offices, collaboration, transparency. So our model in UAE, I will not go through past American or European model. Our model in UAE is we have our critical care support units or organ donation units. We have an OPO. So we are combining two models. We have in the National Center for Organ Donation and Transplantation, we have about 20 nurses that they are fully dedicated to disease organ donation. And then some of these nurses are allocated inside of the hospital with the highest donation potentiality. And of course, we are also collaborating with the Emergency Command Center from the different local health authorities in UAE. So it looks like this. We have a national level when there is the National Center plus the organ procurement organization with direct communication with the hospital and the critical care support units, and in the other side we have the healthcare authorities, Dubai, Abu Dhabi, and Northern Emirates, with the communication with the transplant center. Regarding collaboration and transparency, we also have our organ allocation committees. So for kidney and liver, they decide, they are represented by the head of the transplant programs in the country, plus local authorities, and they are the one who decide the organ allocation rules in UAE. So for kidney, that we have is one of the kidneys, the priority to be transplanted is for the transplant hospitals where the donor is procured. So if the donor comes from Dubai, the preference will be for all transplant centers located in Dubai, one of the kidneys. And the second kidney goes to the pool, and there are priority for organ allocation. Priority for kidney allocation is pediatric, highly sensitized, non-vascular access, or combined transplant liver, kidney, or kidney pancreas. Training, we were seeing in the previous presentation about training. This is one study that just correlates how high level of confidence, high level of education, and high level of positive attitude of healthcare professional, ICU healthcare professional, is linked with high donation rates in the hospitals and in the country. This is another study in Europe that they demonstrated how after these dots are the hospital where the training was performed. So after the training, the number of utilized donor identified increased, and the number of organ recovers also increased. So what is happening in UAE? This is our training, but then we are not only doing big conference and congress. We did that the first year. Now we are moving inside of the hospital. So it's the mandate that all hospitals, they have to create their own in-hospital organ donation seminar. Quality assurance program, we know that we have indicators, key performance indicators, and if we don't measure what we do, how we will know that we are doing well? So we have our mandatory key performance indicator for all hospitals. We audit the hospital. We do external audit from experts from Europe and from America, and we are using our registry. So now we have the Hayat National Registry, which is an IT solution. It's a software that we can monitor everything from the disease donation side, living donation, transplant recipient management, pre and post, of course, tissue management, and the organ donation unit management. So we are in the earliest stage. This is a software already obtained from Portugal, but we are customizing this software to the needs of UAE. Finally, resources. Of course, we also, Ministry of Health and Prevention, have been providing financial resources for this, and also we have healthcare insurance who cover transplantation, and now thanks to the new law, the healthcare insurance must cover disease organ donation as well. And my final slide is about communication with the community. We have our Hayat awareness program. Hayat means life in Arab. And the uniqueness of this awareness program is that we combine two things. It's not only about organ donation, it's about also prevention of chronic diseases. So every time we go to the community, we talk about the two things, prevention and of course disease organ donation. And it's because we believe that organ donation is a right, is the family right to be informed and make their own decisions. We as a doctors, we cannot exercise the right of the family and the doctor's entitlement to present organ donation as opportunity. I mentioned to you, we are a country with 85% of expat. The program right now have been benefit or have been 53 different nationalities have been contributed or benefit to the program. You saw this slide at the beginning. We are sharing organs with Saudi and Kuwait, and we are looking to support all Middle East region. And then my take-home message is about collaborative approach, hospital, regional and national offices, health authorities, health operators. Disease organ donation is a hospital service, is a simple sentence, but believe me, it's a very powerful. If our healthcare professionals start to understand that organ donation is a healthcare service, everything will change. And organ donation is a right. It's the right of the family to decide. We, as a doctors, we cannot decide for them. Thank you very much.